right. So let's switch from COVID-19 to a non-COVID story now. AbbVie, the ticker for AbbVie is ABBV. AbbVie recently announced a partnership with REGENXBIO. The ticker for REGENXBIO is RGNX. And the two companies are developing a gene therapy together targeting wet age-related macular degeneration, or AMD. Now, this deal could be worth up to nearly $1.8 billion, and that includes milestone payments. So, Brian, why did AbbVie team up with REGENXBIO, and do you think this is a smart move for the company?
Yeah, so AbbVie really needs near-term growth. And this is gene therapy. It goes by RGX-314, is in late-stage testing. They're already in one pivotal study already, and then they're going to run and pivotal means that that's the study that we're going to send to the FDA for approval. And then the second, the pivotal trial is on track to start in the fourth quarter. So they'll have data, within, I guess, probably a little over a year from now. And so, and then approval, 8 to 12 months after that. So, AbbVie, that should help AbbVie in the near term to try to increase its revenue, because of course it's losing Humira to biosimilar competition. It seems like it's a pretty good deal for REGENXBIO, and the shares popped on the news of the deal. So investors definitely thought it was. It only has to give up half of the value inside the US. The companies will share the profits equally in the US, and then outside the US, it's going to get a royalty. And probably didn't really want to expand outside the US anyways, at least initially. It's a fairly small company, so I think it was going to probably do a deal outside the US anyway, and so I don't think we got what exactly the royalties are going to be, but presumably hopefully they got a good enough royalty deal to justify giving away the full rights outside the US. And then REGENX also gets $374 million upfront, which will help it pay for the clinical trials. And then there's potential for 1.38 billion in additional development, regulatory, and commercial milestones. Presumably, a lot of that's in the commercial milestone bucket, but they don't break it out. But you can pretty much assume that a lot of it will be bonuses based on the actual sales rather than development or approval milestones. But they'll probably get some money for completing the phase 3 or completing earlier stages testing the gene therapy and other eye diseases, and then of course approvals. It'll get some bonuses as well.
Yeah, I think we'll just have to wait and see if this ends up being a really smart move for AbbVie. I mean, obviously, if this gene therapy pans out, it's going to look like a brilliant move in hindsight.
Yeah, I mean, $370 million is. I mean, they're risking something, but they've got, they've seen the phase 2 data, so they know what they're getting themselves into. So I think it's a fairly good risk, but I think it's a better deal for REGENXBIO, and it's probably has something to do with AbbVie's need for near-term catalysts and the lack of phase 3 products on the market by small companies that want to find a partner.